Dr. Manangazira. I can see Dr. Manangazira is already in. She has joined.
Again, I really appreciate this opportunity, and I want to salute the organizers of this Epilepsy Awareness Week, especially acknowledging the chairperson of the Board of Trustees, the management committee members, the president of the league, Dr. Ngwende, whom we work with very closely, as well as the vice president, Dr. Gwen Kandawashika. And I've had the privilege of listening to her presentation. Thank you very much. But also the vice president, Epilepsy Alliance Africa, Professor Kisam Najib, the followers and researchers and professors at Oxford, some of whom I've also had the privilege to meet and interact with as far back as 2016, Professor Sloan Mahon and Arjun. I also want to acknowledge Dorcas Gwata, who is a global health consultant, and I've also had privilege to meet and interact with her in the past. Yourself, say, Mugumbate, and the other people who are in support of epilepsy awareness, but also epilepsy treatment and care. And last but not least, Taurai Kabjiti, who works very tirelessly to ensure that the rights of those living with epilepsy are taken on board despite our society having so many challenges. So it is really a very welcome opportunity to be part of these commemorations of the National Epilepsy Awareness Week. And I particularly like the theme, making epilepsy a priority, because it's one of those conditions that I would actually gladly put into the basket of my neglected tropical diseases. And I think Dr. Gwen also mentioned that it then remains largely an African problem because we've for a long time not quite prioritized or taken note. So this is one of those conditions where as society or even as a health service delivery system, we can easily pretend that it's not happening, maybe because of the numbers, but what we also know is the numbers are just a tip of the iceberg. There is a whole lot of epilepsy cases that go undiagnosed, undetected. And in the case of the pediatric patient, parents or even the caregivers might think this is a stubborn child, and yet they are having absent seizures. They are talking to the child and the child is not responding. Or it might come out as some behavioral disorder. And in the case of children, or even in some adults, it might be taken as somebody just being difficult or stubborn or rude or even aggressive. And I do have personal experience of a close relative who was a pharmacist, and his epilepsy just manifested as suicidal tendencies. And he'll just lock himself up. Being a pharmacist, he would have a concoction of drugs and take it and wake up in hospital and then, do something different. And when we took him around for medical care, eventually he had an EEG that showed the abnormal trace, and that led to a diagnosis of epilepsy. So I'm just saying this is something that we really need to prioritize as society. And as a medical or a health system, we have to be on the lookout. In surveillance, we call that maintaining a high index of suspicion. And we have to be actively looking out for some of these cases of epilepsy. So it just means that epilepsy is known, but it's very little understood. And that leads to a lot of social problems. And some of the problems, even in those that are diagnosed, because of the misconceptions, the cultural way of looking at it, the traditional practices around detecting and even treating, they might even lead to reduced effects of the medical care that is given. So we need to make a decision, and I think we don't want to lose the momentum that this awareness week starts. I think let's start and keep moving and not stop, so that our actions this week translate into ensuring that there is increased detection, but also effective management of epilepsy, so that the children that do have epilepsy have a chance to get into adulthood knowing but also managing their condition with support from the health service providers. This is a very common neurological disorder, as has already been mentioned, characterized by recurrent seizures. But in some instances, there are no seizures, and I've mentioned my personal experience of a relative. So the WHO estimates are just that, because we are severely underdiagnosing across the races, geographical and socioeconomic boundaries. We really have to be looking out for epilepsy, so that we raise the awareness within society. We also raise the awareness and train healthcare providers to assist patients living with epilepsy to manage the conditions, so that they do not experience limitation either in the academic, the economic and social spheres, and they are able to enjoy their cultural rights. I think we've also seen that sometimes people can't even be married, they can't keep their family together because of all of these misconceptions, but also stigma, which is related to a person who falls down once in a while and they're having seizures. And when you look at even some of the terminology that we use in our local language about epilepsy, it is also stigmatizing. So I think we do have quite a lot of work to do in terms of raising the awareness of this neglected condition. If I may maybe mention more within the health service delivery system, we work by directorates or divisions, and epilepsy is one of those conditions which may be in the non-communicable diseases, but because of the nature of some of the symptoms or the signs even, you find it also in mental health. But when you look at our pharmaceutical services, the medicines are not even prioritized, including those where a patient just needs to take a once a day dosage just to maintain their, seizure-free status, and also that they are able to conduct their activities for daily living and progress in life. We are not even managing to ensure them a constant supply of those medicines. So in terms of data, we are also lagging behind. We do capture data from the health facilities that are able to make the diagnosis. And Dr. Kandawashika did mention our structuring of the health services from the primary level of care, the health facility or the clinic, all the way up to the central hospital. And again, it really depends who you see. But in terms of the treatment guidelines, and unless somebody opens the ed list, you might walk out of that health institution without ever having been recorded as epilepsy. So our data needs to be updated. And there's been mention of a registry. we have not gotten even that far, and that needs to be looked at. So I did mention that we need to maintain this momentum of this Epilepsy Awareness Week. And I would invite you colleagues who are on this call and even others that will get a record of this discussion to write articles. We do have a Health Matters magazine at the Ministry of Health and Childcare. We could dedicate an issue of that to epilepsy matters, just so that we once again remind people that despite a lot of challenges within the health service delivery system, and even amidst the COVID-19 crisis, epilepsy still matters. So allow me, ladies and gentlemen, to call upon individuals, the civic society, other government ministries. This, as we say, it becomes a social and even an economic issue. So I would then also want my colleagues from the Social Welfare Ministry, but Finance and Economic Development, to be on board this work to ensure that we don't leave anybody behind, particularly for the fact that they have epilepsy. I would also end by thanking again the foundation, for the Epilepsy Support Foundation in Zimbabwe, for the work that they are doing. In the past, they have even linked us with the regional and, as I mentioned, the international, in terms of the Oxford fellows that are supporting this work. So I also want to end by encouraging the people with epilepsy to keep fighting the exclusion, the stigma and discrimination, and themselves raising awareness to say we matter. I just want to end by telling another story of we went to Malawi to learn about palliative care, and one of the palliative care patients we came across, he had epilepsy, and he was staying maybe alone and fell into a fire. So by the time they discovered him, part of his head and face had been bent. So when he came to hospital, he couldn't speak very well, and he looked funny and, unkempt, and nobody followed from home because of the poverty. So the clinic, the hospital staff will just write uncooperative. And he continued being unkempt in the hospital. Nobody gave him a bath. And this wound was now getting septic. And after a visit from people who are into palliative care, they talked to him and he was talking okay. And he mentioned that I do have a family, but they are just too poor. They couldn't get bus fare to follow me up here. So they asked the hospital staff whether they could assist him to bath and shave. And they cleaned his wounds. And if like 2 or 3 days later, he was looking at himself in the mirror. So I'm just saying, sometimes we throw away people because we haven't gone the extra mile just to find out about their condition. And I would welcome all of us to maybe go that extra mile, look for, actively for people with epilepsy, support them in terms of getting treatment, but also in in recognizing the worth that they have as individuals. And us as ministry, we need to continue being looking out for persons with epilepsy, but also ensuring that our programming now takes epilepsy as a priority condition. Thank you very much. All the best.